Good evening. I welcome you to the exclusive Kidney Care Show, an initiative by Integrated Health and Wellbeing Council, powered by JP Chemicals and Pharmaceuticals. I'm Riddhi Lakra, Assistant Editor, IHW.TV. And this live session, we will be discussing about the topic kidney transplant. Kidney transplant is a major kidney problem is a major burden in India, with most of the people suffering from it. While kidney is a major player in regulation of the blood pressure and makeup of the blood. When kidneys lose their filtering ability, harmful levels of fluid and waste accumulate in the body, which can rise to the blood pressure and result in the kidney failure or into the end-stage renal disease. People with end-stage renal disease need to have waste removed from their bloodstream via a machine called dialysis or another option with a kidney transplant to stay alive. With intervention of robotic technology, the minimal invasive surgeries gives an absolute precision and accurate possibility which benefits the patient for the faster recovery, smaller scars, and less blood loss. While kidney transplant may seem easy, but there are numerous things one should know about the kidney transplant before undergoing it. To discuss about the problems and the very important, the kidney transplant, we have with us Dr. Sukant Kishore, Dr. Sukant Kishore Das. Dr. Sukant is a senior consultant nephrology and renal transplantation at the AMRI Bhubaneswar. I welcome you, Doctor, for the Kidney Talk Show. Doctor, my first question is a very basic one. When we talk about the end-stage renal diseases, kidney renal disease in India, what is a major reason that we have seen? Doctor, can you hear me?
Yes, I can hear you clearly. Go ahead, please go ahead. Right now I'm not able to hear you. I could hear you a little earlier. Am I audible very clearly? I am not able to hear you. I am not able to hear you. I'm not able to hear you.
As I was asking, what is the major reason?
Yeah, okay. Now I can hear you. Your question was, what are the major causes of kidney failure in general and in our country? Okay, so first of all, thank you very much for initiating this discussion. And as you know, we are on the verge of celebrating another World Kidney Day, and that's on 9th of March this year. And every year on the second Thursday of March, we celebrate World Kidney Day. And World Kidney Day is an occasion where we all make a resolve to fight against kidney diseases. And kidney diseases are very common, very harmful, and if untreated, they can be fatal. So talking about you've just enumerated the functions of the kidney, how kidneys are very important for a healthy life, and what happens when kidneys do not do well or kidneys fail. So to talk about broadly what can be the possible contributing factors towards kidney failure, in our country in specific and in the whole world in general, diabetes is the most common cause of kidney failure, responsible for 60 to 70% of causes of kidney failure, followed by hypertension or high blood pressure. Then there are other causes such as intake of NSAID group of painkillers, familial kidney diseases such as the ADPKD, or if a person has got recurrent urinary tract infection, or if a person has got certain structural abnormalities in the urinary tract or the kidneys, this can also lead to kidney failure. There is another common cause that is emerging in our country, that is chronic kidney disease of unknown origin, where the cause is not exactly known, yet there is a large number of people which is being seen to be suffering from chronic kidney disease without any apparent cause, and that is known as CKDU, or chronic kidney disease of unknown origin.
Thank you, Dr. Das, for explaining that. Doctor, we often see a lot of people suffering from kidney stones. So is it in the most of the cases that kidney, like a renal kidney stage, what we go, and as you said about the chronic kidney diseases, are these kidney stone one of the reasons of that, or there are other reasons related to it?
Yeah, talking about kidney stones, yes, kidney stones, if left untreated, they can give rise to kidney failure. If left untreated, mostly kidney stones are not the direct cause of kidney failure, but kidney stone, it all depends on if where they are located. Sometimes, if they are located at the pelviureteric junction from where the urine passes, and it remains untreated, then they can cause obstruction, and obstructive uropathy in course of time can lead to obstructive nephropathy and give rise to kidney failure.
Doctor, like when we talk about the kidney transplant, and like once somebody is undergoing a dialysis process, and then there's another option of a kidney transplant as well. So in what would be a better option? A kidney transplant is a better option, or continuing with the dialysis is a better option?
You see, before answering this question, I have to say something very important. You know, human kidneys are called as amazing organs. Why they are called amazing organs? Because we all know that kidneys' basic function is filtration of blood and clearing out of the harmful toxins from the body, which are known as uremic toxins in the form of urine, and excessive fluid also is cleared from the body. Kidneys have also other important aspects, such as maintaining of a healthy bone and maintaining of the hemoglobin level, healthy fluid and electrolyte balance maintenance. Kidneys are also an endocrine organ. So all this, and kidneys have a very important role in maintaining blood pressure. Now, when kidneys fail, in end-stage kidney disease, as you have just said, we have two broad categories of treatment. One is dialysis, another one is transplantation. Now, what dialysis does is basically with an artificial machine, it purifies the blood and removes the uremic toxins. But dialysis can never take up the function of a normal kidney. That is why it just about able gives the patient hope of life by clarification of the harmful toxins. But a dialysis has to be performed at least 2 to 3 times in a week if it is a hemodialysis. There is another modality of dialysis. If it is peritoneal dialysis, then it has to be performed every day. But a person has to come to a dialysis unit, and person has to take hemoglobin increasing injections. Person has to take multiple uh, drugs for control of his blood pressure, and the dietary pattern is also not that. I mean, the patient still has to be on a strict dietary pattern. And one more important thing is that it gives a huge psychological and social burden, and patient never feels like getting back to a normal life. So here question, what is the best available treatment that can ensure the patient a near normal possibility of life? So here comes the question of kidney transplantation. That is why we call as kidney transplantation the best modality of treatment available for end-stage kidney disease. Because in kidney transplantation, we take the kidney from a healthy donor, and the kidney is transplanted by an operation known as kidney transplantation to the recipient or the diseased person, the person suffering from end-stage renal disease. Now, the healthy kidney from a healthy donor, when placed in the person or the recipient, takes up all the functions of the normal kidney. They do not have to go for dialysis anymore. Their hemoglobin starts getting normal, their blood pressure starts getting normal, and with the help of a few medications, they can lead a near normal life. And so many parameters of life actually gradually fall in line one after another. That is why it is called as the much better modality, in fact, far better modality of treatment as compared to dialysis.
Uh, Thank you, doctor, for explaining what exactly is a kidney transplant. I was about to ask that question. Doctor, coming to my next question, we see that organs for kidney transplant come directly from a living person, or in certain cases from a deceased person, the deceased donor. So, could you explain what are the different types of kidney transplant that we see?
You see, when we kidney transplant can be various different types. When we talk about different categories, broadly, if you're talking about based on the donor, of course, we have a live donation, and another one is called cadaveric donation. Live donation, when healthy kidneys are taken from a healthy living person, and usually the person has to be a direct relative of the person or the recipient. Usually, in according to the Human Organ Transplantation Act in India, a person can take a kidney from a relative if the person is the spouse, sibling, parents, or even grandparents, or from children also they can take a kidney. And in certain cases, if the person is not related, then there are certain stringent guidelines, government guidelines, that learn a non-relative person, after passing through certain guidelines, government approved guidelines and government approved committees. But it is to be reminded and remembered that all kinds of donation has to be voluntary. There cannot be any financial transaction, and there should not be any force behind. So it has to be voluntary. So this is about life donation. A life donation comes from a live person. That is why the person has to be found fit, and they have to undergo several tests just to find fit, that after donation also they will be able to lead a normal life. The other kind of donation is cadaveric donation, where the kidney is removed from a brain dead person. And there are certain criteria, of course, how to declare a person as a brain dead person. And at that point of time, organ is retrieved, and not just the kidney, multiple organs are retrieved. If a particular state or a particular city has got the facility for multiple organ transplantation, then cadaveric donation can give life to multiple people
Dr.
by.
Das, can you hear us?
Yeah, I can hear you. Can you hear me?
No, doctor, we had a break in between. There was a connectivity issue.
So do you need me to repeat once again? Okay, can you hear me? Can you hear me?
To you.
I can hear you. Is
Yeah.
it okay?
Yeah, now it's okay.
Okay,
If you could
so
repeat that part of the same family donor, what you were explaining.
so you want me to tell about the live donation? Okay, as I was talking about, live donation is a process where a organ is removed from a healthy living donor. The healthy living donor has to be a person from the person's family, directly related to the person, whether it can be spouses, or it's called spousal donor, or it can be siblings, or it can be parents of the recipient, or it can be grandparents of the recipient, or children of the recipient. In certain cases where they are not related in blood, they are not related by blood, it has to be proven that there is no financial donation, there is no financial exchange, and there is no force or compulsion in between the donor and the recipient. And it has to be voluntary, and it has to be passed through a stringent guideline approved by different state committees. So this is about life donation. So I hope I'm clear with that. Okay. So talking about the other kind of donation, that is called as cadaveric donation. Cadaveric donation is basically brain dead donation. Brain dead person's kidney is removed. In that case, when you're talking about healthy donors, we can remove only one kidney because the person has to live a normal life with the other kidney. But a cadaveric person is, of course, we have already lost that person. So both the kidneys can be taken out, and two recipients can be benefited. And not just kidneys. From a cadaver, if a center has the facility, of a state or a city has the facility, sometimes you must have heard organs being carried from one place to another. So a liver can be given, even other organs can be carried out, and other needy patients can be given. So that is why it is often told that don't take your organs to heaven, because there are many persons who are in need of some kind of end stage organ failure, in the need of organs, and they can get a new lease of life. Okay.
Thank you, doctor, for explaining that. But doctor, just like a funny way, like a lot of people, we hear that people can go and donate their kidneys for sake of the money. So is that a true thing,
No,
or
that is
is just
absolutely.
there are
Oh,
strict rules regarding that?
absolutely. You've got a very good question here. That's what I tried to mention, that once again, that there is no such provision where people can donate their kidneys for money. So should be it should be totally discouraged that they should not even have such thoughts there in mind. And kidney donation, a person can donate kidney only when they have a family member who is affected from the kidneys, or if they have a friend or relative affected from kidney failure. but it has to be through stringent guidelines, and it has, the first thing that has to be proven is that there is no financial exchange, no kind of compulsion on the donor, and the donor has to do it totally voluntarily for the sake of saving a life.
That's very interesting, and I hope such strict rules should be there so that
Yeah,
people
of course,
who are
these
actually
rules are
in
there.
need of the right kidney can get that. Doctor, coming to my next question, we talk about like once somebody wants to go under a kidney transplantation. So, what are the various tests which are done before a transplantation, and like while the person is going undergoing dialysis? So, if they have a possible donor, so what are the tests one can go under to check for a transplantation?
See, of course, I mean, but the patients themselves do not have to worry a lot about it, because any center which is planning to carry out the organ transplantation, there are certain series of tests which are usually done. So, just for the sake of emphasis, I can say that we have to do certain tests in the donor and certain tests in the recipient. We have to ensure that the donor and the patient are compatible in blood group. Sometimes, if the blood group compatibility is not there, then we have to they tell them that we will take them for an ABO incompatible transplantation. So blood group is the first thing we do. If the blood group is compatible, then of course we go ahead with the compatible transplantation. If the blood group is not compatible, then we have to tell them we have to go for an ABO incompatible transplantation. Now, what is this compatibility? Normally, there are four blood groups in all human beings in the world. O blood group is the universal donor, and AB is the universal recipient. The other two blood groups are A and B. Now, O person can donate either blood or organs to everyone, and AB person can receive organ or blood from all other blood groups. A can receive from O and other A blood group person. B can receive from O or other B blood group. I hope, am I audible and clear? Okay. So now, uh, conventionally, we used to go with this pattern. But there is a new trend where we can go for ABO incompatible transplantation, where a person of A blood group can also donate a kidney to O blood group person. And here in Bhubaneswar, we are doing ABO incompatible transplantations regularly, and it is being done in several centers all over the country and all over the world, with increasing success. And this increases our overall donor pool. So this is about first thing about blood group. Then, of course, we have to ensure that the donor has got a normal biochemical parameters, normal hematological parameters, their imaging should be normal, their cardiac or heart status has to be normal so that they can withstand the transplantation. Similarly, the recipient has to be looked into, that they can withstand their vital parameters, their hemoglobin, biochemical parameters, all these things should be normal. Then coming back to the next stage, the matching or the HLA typing of the recipient and the donor has to be done. And these are transplant immunology workup. These tests come under transplant immunology workup. After the HLA typing of the recipient and donor is done, we also do a cross matching test. Cross match can be CDC cross match, flow cytometry cross match, or a Luminex cross match. And cross match, we basically see if the most important part in kidney transplantation is when a foreign organ is implanted in the recipient's body, human body tries to reject it. So we have to see if there are any pre-existing antibodies against the organ or not. That is how we eliminate the possibility or detect the possibility of having any pre-existing antibodies by this cross-match test. The cross-match test has to be negative, and the donor-specific antibody, there is another important test in transplant immunology, and the donor-specific antibody has to be less than at least 1000 MFI. So these are some of the indicators. And of course, the donor, we have to see the donor CT angio has to be done. We have to ensure that the kidney and vascularity is good. And of course, we have to see that the donor kidney's GFR estimation is done, and the donor kidney GFR, if the donor kidney after being transplanted into the recipient will function normally or not. So all these tests, starting from biochemical tests, hematological parameters, certain advanced imaging studies, TTP or nuclear medicine will give us a GFR study, and also the transplant immunology workup will give us an indication about how good the matching between the recipient and the donor is. All these are important parts of investigations that is normally known as a broad category of transplant workup or pre-kidney transplantation workup.
Uh, Thank you, Dr. Das, for explaining that. Dr. Das, like we often see that in most of the cases, people do not get kidney so early. It is not so easily available. In that case, who would require a kidney transplant? If the patient is very serious, what exactly is the condition of the patient that they should go under a kidney transplant immediately? Or are there any specific stages of the end stage kidney disease?
No, I mean, kidney transplantation, it has to be remembered and it has to be reminded that kidney transplantation is an elective operation. There is nothing called an emergency kidney transplantation. Nobody in this world would tell that they require a kidney transplantation on an emergency basis. What is important is that while a person is waiting for an organ, or whether it's a live organ or a cadaveric organ, the thing they have to continue doing is undergo their dialysis. If it takes 6 months or sometimes more than 1 year or more than 2 to 3 years, people have undergone kidney transplantation even 4 to 5 years after dialysis also. So a person of end-stage kidney disease has to remain on their dialysis till a organ or is available to them, whether by live donation or by cadaveric donation. Certain persons who have been found to be having chronic kidney disease, if at the stage 4 itself we tell them the possibilities, then it gives them greater time and it gives them greater amount of mental preparation. So by the time they reach stage 5, then we can go for early kidney transplantation because they have already prepared at the stage of chronic kidney disease stage 4 itself. And that is known as preemptive transplantation. I just mentioned about stages. Chronic kidney disease is into 5 different stages: 1, 2, 3, 4, and 5. Stage 5 is known as the end stage kidney disease. And stage 5 is end stage kidney disease, and stage 4 is the just pre-end stage kidney disease, where the person is counseled that they are definitely going into land into end stage kidney disease, and that is the point of time they have to prepare themselves for a kidney transplantation. Okay.
Dr. Das, coming to my next question, when we talk about the kidney transplant in here in India, what are the advancements that we see? Are there a same form of transplant which used to happen earlier, and people used to be on bed for months together, and for the recovery was much slower. So how has it changed? And if you could tell, what are the new advanced technologies available for the kidney transplant?
See, when we talk about advanced technologies, there are two aspects. One is the surgical aspect, and another the medical aspect. The surgical aspects, we have lap donor nephrectomy, we have got robotic surgeries. So all these surgeries actually help in precision of the whole surgery, so that after the surgery, the donor doesn't have to stay in the bed for a long time. Sometimes they are discharged in 2 to 3 days after transplantation. And the other aspect, being a nephrologist, what I am more concerned about is the medical aspects of the kidney transplantation and what recent drugs we have. With the advent of immunosuppressive drugs we have, and with the advent of various pre-immunological tests, pre-transplant immunological tests, we have been able to make sure that the chances of rejection after transplant are minimal. Transplant is the most important risk in case of a kidney transplantation is the possibility of a rejection. So we have to make sure that we have to minimize the possibility of rejection. So how do we minimize that? If it is abio compatible transplantation, we have to see whether the patient is sensitized or the patient has got certain amount of antibodies before in his body before the transplantation. In that case, we have to do certain sessions of plasmapheresis to remove those pre-existing antibodies. And we have to ensure that we give certain induction agents, whether it's thymoglobulin or it's basiliximab. Then, of course, we have to ensure that we give the right dose of immunosuppression in these patients. And if a patient is going for abio-incompatible transplantation, the most important thing in abio-incompatible transplantation is removing the specific anti-A or anti-B antibodies, the pre-existing abiotype antibodies are to be removed. And how it is done? Earlier, it was done through plasmapheresis, which was non-specific. Now we have got specific columns, specific columns which can remove and target specifically. We have got glycoside columns, either it's a column or a B column. So that especially removes. Suppose a person of A blood group is going to donate a kidney to the person of O blood group. Now, person of O has already anti-A antibodies. We have to ensure and search the person through certain double filtration plasmapheresis process and an immunoadsorption process through which we remove the anti-A antibodies. And similarly, if a person of B is going to give it to O, then anti-B antibodies have to be removed. With the removal of these antibodies, the person's sensitization is significantly reduced. And after the transplantation, with routine immunosuppression also, the chances of rejection are minimized, and the person, the recipient itself, can lead a long life and a stable life, and a stable life with stable kidney function.
Dr. Das, when we talk about the stable life, so what are the success rate of a kidney transplant? And after that, how long one can live after a normal kidney transplant?
See, of course, the success rate of kidney transplantation, when you talk about 1 year success rate, is around 90 to 95%. With passage of time, it's increasing even more than 95%. When we compare the same thing with dialysis, of course, the 1 year success rate is not more than 70%. So we lose more patients on dialysis or waiting for an organ transplantation. But if we give an organ, the benefit of organ transplantation to the same recipient, then there is a larger chance that they are going to live. And what is even more important is that it is not just the ability to live, it's the ability to live a normal life. Talk about kidney transplantation, it can dramatically change the quality of their life. They can go, whether it is occupational life, whether it is their conjugal life, whether it is their social life, whether it is their I mean, every parameter of life changes, and they can get back to normal stream of life after an organ transplantation.
Also, thank you, doctor, for explaining that. There's another thing what I want to ask. A lot of people who both the kidneys have failed. So, is it a chance that they do get both the kidneys as a replacement during the transplant, or they can just survive with one?
No, no, that is a very important aspect you have asked. I think I must make it clear. Kidney failure occurs only when both the kidneys failed. If a person's one kidney fails, uh, the person doesn't land into kidney failure, because that is what a donor is. From a donor has two kidneys. We remove one kidney from the donor, and the donor needs an absolutely normal life with the help of one kidney. So in the recipient or the person suffering from end-stage kidney disease, of course, both the kidneys have failed. Thankfully, we do not have to replace two kidneys. We just replace one kidney, or replace in the sense that we transplant one kidney, but the native kidneys are mostly not disturbed. What is interesting, a lot of people do not know, even a lot of young medical students do not know, that in a patient who is undergoing kidney transplantation, their native kidneys are not removed. The native kidneys are on either side of the vertebral column towards the back of the person. The new kidney is transplanted somewhere on the abdomen, on the right lower abdomen. So on the front side of the abdomen, you must have seen patients having a scar. It's the right inguinal region, right iliac fossa, normally we call it. So there a kidney is transplanted. So a person of kidney transplantation who has undergone a transplantation would effectively have three kidneys in their body: two of his own kidneys, which of course are not functioning, and the newly transplanted organ. Once the transplanted organ or kidney is placed in the recipient's body, it is connected to the blood vessels and it is connected to the bladder. So it starts taking up the normal kidney function of the body, but native kidneys are not normally removed. And of course, we only replace only transplant one organ. One kidney is uh, transplanted into the recipient. Sometimes if the transplanted kidney fails, then on the left iliac fossa, patients have gone into second kidney transplantation as well. In that case, with their two native kidneys and one kidney in right iliac fossa which has already failed, so they may have four kidneys in their body, which is sometimes, which happens rarely, but people have undergone for second kidney transplantation as well.
Actually, even I have come to know now only that the kidneys are not removed from the body. It's just a curiosity. So, are there no infections, and can this the remaining the native kidney what you have
Yes,
not
that
removed,
that
can that
exactly.
create any problems in the future?
No, that is also another interesting thing you've told me. It's there are certain very specific indications where the native kidneys are removed. Normally, when a kidneys fail, they are not usually infected. But rare circumstances, if the failure happens due to an infection, if there is any abscess, if there is presence of pus or something like that, then in that case, the native kidneys are removed only to get rid of that infection, and it's not it's done sometime prior to the transplantation process. Another thing where the kidneys are sometimes required to be removed is called adpkd. Adpkd is adult polycystic kidney disease, where both the kidneys have multiple cysts, and both the kidneys are normally, if this size, they enlarge. They are so large in size that in the abdominal cavity the space is so restricted that we do not have space to put the new kidney, and because of their enlarged size they cause several mass effects. In those cases, sometimes the native kidneys are removed, sometimes one native kidney is removed, sometimes both native kidneys removed. But normally, when the cause of kidney failure is because of diabetes or hypertension or chronic kidney disease of unknown origin or glomerulonephritis, usually the kidneys do not cause such direct infection, and their sizes are usually shrunken, so they just remain inert. They are not functioning, they are inert in their place, so they do not have to be removed, because removing a native kidney itself is a nephrectomy, is a major surgery, and it has to be done only when it specifically is required. It doesn't have to be done for all cases of kidney transplantation.
Thank you so much, doctor, for explaining that. That's coming to my very next important question. When we talk about kidney transplant, it is a costly affair. So, are there? Could you explain the audience, like there are two parts, like there are this schemes like Ayushman Bharat, that is also might be helping the patients, and even the private like the finances which are given. So, can these be helped? Or and could you also give in a rough estimate that what could be a cost of a kidney transplant if somebody is looking for?
Okay, so here you have rightly pointed out Ayushman Bharat, and its different versions in different states. If I can talk about my state, state of Orissa, we have a hugely successful BSKY, that is Biju Swasthya Kalyan Yojana, where under that scheme, which is it's the state version of the national program, where the patients who undergo kidney transplantation, almost the entire cost of kidney transplantation is taken care of by the government's funding, and it has been started for almost more than 1 year from now, and it has been going on successfully. Not just kidney transplantation, there are various other medical and surgical procedures where this benefit is extended to patients. But the most important thing, because there was a time when people felt hopeless that they don't have finances, and it's a huge surgery, it's a, hugely expensive surgery, and finances was a huge burden. But uh, thankfully, with the BSKY and this Ayushman Bharat scheme, uh, these people are being taken care of. But there are certain areas, maybe there are certain middle class population who are still not don't have the opportunity to get into this scheme, or they are not uh, able to avail this scheme. And there are certain other aspects which I must tell, more or less most people should get a medical insurance for themselves for this unforeseen circumstances, along with government's funding. If they have got a private medical insurance, then it does give them an added advantage. And so, kidney transplantation, financial blockade or financial what do you call hardship is no longer an hindrance for kidney transplantation. And why not? Why just transplantation? Even every nook and corner of Odisha, we have got dialysis centers, government approved and government funded dialysis centers, where patients can undergo dialysis free of cost. And in corporate hospitals also, patients with this scheme can undergo dialysis free of cost. So both in terms of dialysis and transplantation, two modalities of important treatment for patients of end-stage kidney disease with government's funding, definitely patients can avail, and money is no longer a hindrance.
Thank you so much, Dr. Das, for explaining that. And I hope a lot of people can avail this benefit from the government. And also, as you suggested, people should go and take their personal medical insurances as well. Doctor, coming to my almost a last question, while we understand that kidney transplant can only be in the very last end stage of the kidney disease, how can somebody like change their lifestyle and like reduce the risk of any kidney diseases? And that can be a closing note for today.
So that's the most important thing, because having said about all the available options of end-stage kidney disease, it'll be far better if we never have to land at those conditions. So how can we do that? We can do that by looking at the various risk factors. If a person has got diabetes, early stages of diabetes, they have to look into control of their blood sugar, control of their blood pressure. If the person has got blood pressure, they have to look into adequate control of blood pressure. Then they have to look for which drugs are safe for their kidneys. And the next important thing is the dietary pattern, which of course most of us do not look into in our day-to-day lives. We have to be very sure that we have to control the animal protein has to be low, the salt intake has to be low, and inadvertent intake of painkillers has to be avoided, and avoid smoking, resort to a healthy lifestyle, avoid excessive body weight gain. Persons with obesity are also under the risk of kidney failure. So all these important risk factors are to be taken care of. And those persons who have got early stage of kidney disease, it is important that we may not entirely stop the progression, but we can delay the progression. We can delay the ultimate consequence for many years. So there are many drugs that are available along with this lifestyle modification. There are new group of drugs such as SGLT2 inhibitors, which are proving to be dramatic in terms of delaying the progression of chronic kidney disease. So these are another important aspect. So people have to, of course, the overall things vary from person to person, but the overall guideline is that, first of all, maintain a healthy lifestyle, maintain regular exercise, avoid smoking, avoid high protein intake, especially avoid animal protein intake, or restrict animal protein intake, restrict or avoid alcohol intake, maintain your blood pressure, control your diabetes. And if you have a family history of kidney disease, or if you have a risk factor of all these things, do get tested yourself. Especially persons more than 50 years of age should get tested themselves. Very simple tests such as urine examination or hemoglobin and a routine ultrasound. All these things can very simple, inexpensive tests, but can give us if underlying clues about if there is any serious illness present, if there is any serious illness present or not.
Thank you so much, Dr. Das, for explaining everything so nicely. And I hope like a lot of our listeners who are listening will understand about the kidney problems in India, and also the the option which is available, the kidney transplant. I hope they have got some of the insights from this, and we hope such videos would create more awareness about the kidney diseases here in India. Thank you everyone for joining. On behalf of the ISW Council, I would like to thank you, Dr. Das, for joining us and taking your time for this important discussion. And my special thanks to JB Chemicals and Pharmaceuticals for supporting this initiative. As we keep doing this awareness program about the kidney diseases, we hope such initiatives will help more people. And this year, as we celebrate the World Kidney Day, we can tell more people about the problem, and we can reduce the burden of kidney disease in India. Thank you so much again. Have a good evening.
Thank you very much.
Thank you so much, Doctor.